So for me, efficiency in implementation as well as equity are really key, and must go hand to hand to truly end malaria, because we really need not only tools, but we really need to be smarter delivery of malaria intervention, stronger system, and then African-led solution. So I believe that the future of malaria elimination must be owned and shaped by those who live it daily, and this is as African.
Hello and welcome to another episode of the Africa Within podcast, where we explore critical conversations shaping the continent around health, peace, and climate change, and highlight the voices leading change and finding solutions. I'm your host, Nontobeko Mlambo, and today's episode is dedicated to World Malaria Day, which is observed every year on April 25. Malaria remains one of the deadliest diseases in Africa, killing over 500,000 people every year, most of them children under the age of 5. But Africa is also home to the greatest resilience, innovation, and leadership in the fight to eliminate malaria once and for all. Today, we are incredibly honored to be joined by a powerhouse in this fight. Dr. Corine Karema is a seasoned public health expert from Rwanda with over 20 years of experience in malaria control and elimination efforts across Africa. Dr. Karema is a director of malaria entities and global health at Quality and Equity Healthcare in Rwanda. She has served as a director of Rwanda's National Malaria Control Program. She serves as the interim CEO of the Rollback Malaria Partnership to End Malaria, a global platform mobilizing action and resources to end malaria. She's also served and continues to serve in a number of technical committees, including as a member of the World Health Organization Program Advisory Group of the RTSS Malaria Vaccine Implementation Program, among many other roles.
All right. Thank you so much, Dr. Karema, for joining me today. Could you please just introduce yourself, talk about your work in malaria eradication efforts and research, and maybe about your organization, Quality and Equity Healthcare, and what it does?
Okay, thank you very much. First of all, it's a great honor to join this podcast. So I'm Corine Karema. I'm from Rwanda. I'm the founder and CEO of Afrika Kwanza Health Impacts, which is a Pan-African organization dedicated to strengthening health system and supporting national malaria control and elimination efforts. So previously, I led the Rwanda National Malaria Control Program over a decade, and I also serve as the interim CEO of the RBM Partnership to End Malaria. And currently, I'm also serving in many boards and provide strategic technical advice to international organizations like WHO, the Global Fund, the Gates Foundation, and other global health institutions.
Yeah. So I know that you have over 20 years of experience in public health, but in the beginning, what inspired you to work in the fight against malaria?
Okay. Yeah. First of all, I'm a Rwandan. I'm an African. I was born in the DRC, the Democratic Republic of Congo. And of course, you know that malaria in Africa, it's a public health problem. So we got used to people getting malaria, dying from malaria. And my journey began as a physician, seeing, of course, not only seeing first-hand devastating impact of malaria at home in our communities as a child, but also at the hospital, pregnant women and children. And then I was also really particularly struck by the inequalities in outcomes, depending on where people live or how close they were to clinic. So for someone who has money, who could seek healthcare, was cured from malaria, but poor people in our community We even know children who died from malaria, while we know that malaria is a preventable and treatable. So this motivated me to engage in public health. So my first work was in a remote area in Rwanda, where I was a medical doctor doing research on the new anti-malaria drugs, the current anti-malaria drugs that we use. So I was really seeing the difference between the new drug versus the drug that was treating people, but they keep continue coming for the same disease. So this is how I engage in public health, dedicate my career in strengthening system, as well as how to reach the most vulnerable. And this is how I end up in malaria, in the global malaria space.
Yeah. So, having worked in this field for such a long time, how would you describe the current state of malaria in Rwanda or also in the whole continent?
Yeah, so first of all, I think it's really important to say that when you look at the pattern of malaria, since 2000, there have been remarkable progress made in regard to the fight against malaria. So, for instance, between 2000 to 2015, we have seen that 2.2 billion malaria cases, as well as around 12 million of deaths were averted. But of course, today malaria still remain a public health a major public health challenge, because when you look at the WHO, the World Health Organization reports of 2024, you see that in 2023 alone, 600,000 lives were lost due to malaria. And when it comes to Africa, Africa bears 95% of global malaria burden, with children under 5 and that are disproportionately affected. So you see, for instance, uh, 3 out of 4 patients of malaria in Africa are children under 5. So we have 76% of children that are getting malaria, and from which you have more than 600,000 deaths. And this is, as I say, you can maybe estimate, when we look at the data, you can even say that we have one child dying from malaria every minute. So just imagine the time that we are going to spend during our podcast, how many children are going to die due to malaria. And then, of course, in Africa, you have like 11 countries that are accounting for two-thirds of all malaria cases. And this is where actually we should focus our resources for us to eliminate and end the disease. Of course, we have countries like Algeria, Cabo Verde, Mauritius that have eliminated malaria, but most of African countries remain heavily affected. And of course, there is wide disparity. For instance, in the southern region, you have less malaria cases compared to the West Africa or the Central Africa. So when it comes to Rwanda, I'm proud to say that Rwanda has made significant progress in reducing malaria incidence and mortality. So, for instance, when you compare the year 2016 to 2022, you see that there is a 60% reduction in malaria cases, as well as the number of deaths.
Yeah, you
Yeah.
mentioned how Africa still carries a huge burden of children dying from malaria. So the RTSS malaria vaccine, which was first recommended by the WHO to prevent malaria in children, is a major development. What impact is it having so far?
Yeah, so it's true that the malaria vaccine was a breakthrough in the malaria response. You know that the work that has been done to develop the malaria vaccine took like 50 years. And today, not only we have the RTSS malaria vaccine, but you also have the R21 matrix M vaccine. So the RTSS malaria vaccine was approved by the World Health Organization in 2019. And then you have the new one, the R21 matrix M, which was approved in 2023. So for the first one, the LTSS, it's when you look at the impact, the vaccine was evaluated in three countries: Kenya, Malawi, and Ghana. And among the children that were vaccinated, we saw that there were 30% efficacy in reducing severe malaria. So that's really the impact that we are seeing with the vaccine. And of course, as I said, the new malaria vaccine has shown more efficacy because the R21 shows that we have 75% efficacy in trials. But of course, this need also to be evaluated in the really life as it was for the RTSS. And what is good is when you look at the data of WHO up to April 2025, we have 19 African countries that have introduced this vaccine into their national immunization program, and nearly 5 million of children have been vaccinated. So I can say that the impact is promising, especially, of course, as you know, the malaria vaccine is not a bulletproof tool. So it need to be combined to other existing tools like sleeping under treated mosquito nets, to seek healthcare, so early diagnostic and treatment, spraying houses with insecticide, as well as other intervention that needs to be done.
So you mentioned these two vaccines, the groundbreaking advancements in preventing malaria. What other strategies have proven most effective in reducing malaria cases and deaths in Rwanda and in maybe other African countries?
Yeah. So when I take the example of Rwanda, there are many factors that have proven to be most effective in reducing malaria, as well as improving health. So you have those specific interventions that are really related to the malaria intervention. Like, for instance, in Rwanda, they have scale up integrated approach. So you have the deployment and distribution of long-lasting insecticide-treated nets. You have early diagnostic and treatment by community health workers. So you have community health workers that you have three community health workers per village who are managing febrile illnesses at community level. So they're treating malaria, pneumonia, as well as diarrhea, and then also assessing the nutrition status of children. And then you also have indoor residual spraying, so spraying insecticides on the whole in high burden districts, as well as early diagnostic. But what is also very important is in Rwanda, you also have a strong national leadership, as well as the use of data to really target all the malaria intervention. But of course, there are other interventions that are being scaled up in other countries, which are not being scaled up in Rwanda. So I talk about, for instance, the long-lasting insecticide-treated nets. So there are next generation nets that are being delivered in sub-Saharan Africa. And in for instance, in 2023, there were 195 million of mosquito nets that have been delivered to African countries. You also have the seasonal malaria chemo prevention. So this is a treatment that is being given to children under 5 before the raining season.
Yeah.
And this is already implemented in 19 African countries. Of course, this is a strategy that is implemented only in the Sahel. That's why it's not implemented in Rwanda. And for instance, we have, according to the data of the World Health Organization, more than 28 million children that were treated, for instance, in Nigeria alone, which you know that this is the country where you have more than 20% of all malaria cases worldwide. And then we also talk about the malaria vaccine. We have the two WHO recommended vaccine, the RTSS as well as the R21. This is also already implemented in 19 countries. And of course, as I say, diagnostic and treatment is really important, as well as IPT, which is also a preventive chemotherapy that is given to pregnant women in malaria endemic countries, so that can prevent them to get malaria, and then also to also have all the consequences of malaria during pregnancy. So low birth weight in the children, as well as losing babies and etc. and anemia. Yeah.
Yeah. You spoke of data collection. What are the main gaps in malaria data collection today, especially in rural or conflict affected regions?
Okay, so currently, I mean, it's as I say, 95% of malaria cases are in Africa. So
Yeah.
first of all, the gap in data collection, maybe it's really part of the big issues of health system, because, for instance, most of in Africa, maybe 50% of malaria cases are not taking healthcare to the public health sector. So, and that means you have number one, underreporting malaria cases. The second one is also you also have limited surveillance infrastructure. There are many
Yeah.
countries where they're not able to tell you how many cases they had or how many pneumonia or diarrhea, because they don't have a strong health information system. And then the other one is, as I say, 50% of malaria cases usually go to the private sector. And in the private sector, that can be private clinic, that can be a pharmacy, that can be informal, you know,
Yeah.
nurses or doctor. And then there is no integration of all these data into one system for a country to know how many cases. So basically, the huge gap is more on the system, the health information system, in its
Yeah.
way that's not integrate all the data. And then even when there is data, you see there is underreporting. Sometimes there is quality, poor quality of data, which I feel that does not give us really the really picture of malaria in Africa.
Yeah.
And then especially when it comes to conflict zone, as well as rural setting, you have those fragmented data collection system, and then our infrastructure. So delay in reporting how data coming from a remote rural area reach the central level or the district level when there is no electricity, there is no roads, there is no transportation. So those are all internet, even connection to internet. Those are the issues that are really affecting collection and reporting of malaria data.
Yeah, I know that this is one of the challenges, like you just said now, and the fact that we have not reached zero malaria, and we are talking about this topic today means that there are challenges that we still have to overcome. What are some of these key challenges that still hinder malaria eradication in Rwanda or in just the whole continent?
Yeah, so there are many challenges. So maybe that I can group in three category.
Yeah.
So number one, we have all the biological traits. So for instance, today we have insecticide resistance. So we have the vector, the mosquito, that is not being killed by the current insecticide that we are using. So this is one of the issue, and it has been seen in many African countries. That's
Okay.
why people are now uh, buying more expensive mosquito nets that has
Okay.
dual insecticide or insecticide that are combined with synergies. This is number one. Number two, we also have drug resistance. So we are having already 8 countries in Africa where, including Rwanda, where the current anti-malaria drugs are showing that there is resistance. So someone can be treated with the correctly with the anti-malaria drugs, but at the end it comes back with again the disease. So this is the number one. And then we also have new species. So we have new parasites. For instance, that parasites that were among the monkeys that are already now being seen in human, and that also transmitting the disease. You also have new species of mosquitoes like the Anopheles funestus that before was only seen in Asia. Now
Yeah.
you see that in Africa, and it's also impacting the transmission of the disease. So those are maybe biological challenges, but you also have technical challenges, and this is where my area where I'm supporting national malaria control program. So you see that we still have many barrier. We have mosquito net available treatment, but you will see that many children and pregnant women are still lack access to insecticide treated net or to timely diagnostic or preventive treatments. And you also on top of that, you have those global challenges. Those are broader global trends such as humanitarian crisis and climate change that are really exacerbating vulnerability. So, for instance, when in 2023, 80 million of displaced people who are living in malaria endemic areas. So, just imagine without access of healthcare, with the
Yeah.
poor living condition, this is really clear that they are more vulnerable and susceptible to get malaria. And then
Yeah.
the last one, which is currently the big one and which is being discussed everywhere, is the financing. Financing remain really far below what is needed. So out of, for instance, the 8 billion US dollar that was needed to fight to respond to the malaria in 2023, we only got less than 50%. And
Yeah.
then, as you know, recently there are many changes in terms of the international development heads
Yeah.
uh, with many key players that are supporting not only the global health but as well as malaria. So it's going even to be very difficult, very tough. For instance, if I take the example of the US was funding 37% of the malaria fight,
Yeah.
specifically in 27 countries. And then when there is a study that was conducted by the MAP project, the Atlas MAP project, which was showing that if this funding is disturbed, we are going to have more than 15 million cases
Yeah.
as well as 100,000 deaths additional to what we usually have. And those are really the possible scenario that this project has simulated when you look at the funding cuts from the malaria funding.
Yeah. On the issue of funding, what should governments maybe should be what should they be doing to close this gap if we
Yeah,
don't get this funding?
yeah. First of all, I believe that we need to be smarter in the way we are doing business, because I believe that number one, are we sure that we are spending very well? Are we using appropriately the current resources that we have? And number one, it's maybe we need to internally look at how are we using and the current available resources,
Yeah.
because I believe that we can use the data to target and to tailor the intervention to the most vulnerable or the most affected or the highest burden districts. I think this one we are going to get more impact. This is number one. Number two is how do we uh, convince uh, African government? Because, as I say, more than 60% of the funding coming for to fund malaria response are international funding. So I think it's really timely that the African government decide and be mobilized to fund their own. I know that in March last year, there are ministers of health for 11 high burden African countries that have signed the Yaoundé Declaration. So, in that declaration, they've affirmed that no one should die from malaria. So, it's a zero malaria declaration. It's good. It's really showing political commitment, but I think it's very important that African leaders translate their political commitment into concrete action, particularly in increasing domestic funding.
Yeah.
And while increasing domestic funding, they have also to be to be data-driven targeting, so that at least the money goes where it's needed according to the priorities and
Yeah.
for more impactful malaria intervention.
Right now, as we are living in this digital age, technology is finding solutions for many of the challenges that we face, whether it's AI or many other tools. How is technology being used in the fight against malaria, for example, in surveillance, treatment, or prevention?
Yeah, so innovation technology is being used and is really proven also to improve the way the fight against malaria is being carried out, the way the response is being done. So, for instance, I can just give simple examples, like in Rwanda. Community health workers are using mobile health tools. So, just mobile phones,
Yeah,
device that help them not only to track outbreak, but to also report to all the maternal death.
yeah,
And this is really helping also in the treatment, diagnostic and treatment of malaria. So basically using that mobile health tool, it's not only improving all the issues that we were talking about data, so improving the data quality, transmission, timely recording of malaria cases or any other disease, and also timely reporting, and then of course action, because when you have timely data, you can even act it promptly. So this is number one. Number two, it's for instance, I can take also the example of the GIS and remote sensing that are
yeah,
using to mapping the vector risk zone. So for instance, in Rwanda also, and this is also done in many other African countries. So they are mapping the vector risk zone for them to go and spray the insecticides to prevent and kill the mosquito, so that can prevent the malaria disease. And then,
Yeah.
of course, in terms of surveillance for the treatment, so there is the molecular surveillance that is really used to detect drug resistance. And then there are also drones. So there are many countries now, Rwanda, Ivory Coast, Tanzania, they're using drone, for instance, to deploy on-time vaccine blood packs, so that at least you can have a timely and then you don't have disruption of all the commodities that are needed to either prevent or treat diseases. So those are kind of technology that are also being used in malaria as well as in other health matters.
Yeah. Finally, do you believe that malaria can be eliminated in Africa within our lifetime? Or if not, what would it take for that to happen?
No, definitely. I believe that malaria can be eliminated in Africa and within our lifetime. So, and I really believe, and I was even part of the Lancet Commission on Malaria Education, because I really believe that we have the tool.
Yeah.
Uh, we need to be smarter, and we need also to rethink on the way we have been doing business. And then when you look at all the funding that are going, especially with the support of the Gate Foundation, all the innovation, all the tools that are being developed, it's really improving and addressing all the challenges that we are having in the fight against malaria. And as you know, the theme of this World Malaria, it's we need to reinvest. So
Yeah.
more funding, we need to reimagine. So the system, we need to rethink on how we are reknitting our effort. And for that, we need political will, we need
Yeah.
local leadership, innovation, the use of data, and then, of course, equitable delivery of malaria intervention. So the tools exist. We talk about vaccine, the mosquito net, diagnostic, but what we really need now, it's more to focus on delivery and then also on sustainability, because what we need to do is we need really to be recentered on Africa leadership, national ownership, and efficient implementation. So it's really important that we get funding from domestic, from African countries, and then we also use very well what we have. I say we have the tools, so it's time to deploy them more smartly, more equitably, and then also all this under the leadership of the African. So for me, efficiency in implementation as well as equity are really key, and must go hand to hand to truly end malaria. Because we really need not only tools, but we really need to be smarter delivery of malaria intervention, stronger system, and then African-led solution. So I believe that the future of malaria elimination must be owned and shaped by those who live it daily, and this is as African.
Thank you so much. That's such a beautiful message to end on. Thank you so much for your time.
Oh,
We've come
thank
to
you.
the end of our interview. Thank you just for also all that you do for the Africans in the public health space. Thank you so much.
Oh, thank you very much.
We say thank you to Dr. Karema for incredible insights and for the work she continues to do for a malaria-free Africa. As we mark World Malaria Day, we are reminded that this disease is preventable, treatable, and beatable. To our listeners, let's stay informed, support public health efforts, and raise our voices for health equity in Africa. Malaria may be centuries old, but the future belongs to those fighting to end it. This is Africa Within. Don't forget to subscribe, share, and keep the conversation going. Until next time, stay healthy and stay hopeful. Goodbye.